Are we live?
Stand by, stand by, stand by for my voice. This is Jeff Breedlove with the Georgia Council on Substance Abuse here on Thursday afternoon with the soon-to-be Emmy-winning Neil Campbell report. We're always glad to have our Executive Director, Neil Campbell of the Georgia Council on Substance Abuse, make time for us during COVID-19 to bring news about recovery in COVID-19 and how we must make sure that the Georgia recovery community is being well heard, well represented, and well known about during COVID-19. And Neil, we are live. We have a couple of people on right now, and I know others are going to log on. So before we get into the meat of it, I know some folks know this happens right at 3. Let me just say that the topic today that we're going to talk about is, well, Neil, why don't you tell us what we're going to talk about for a moment.
Yeah, thanks, Jeff. This is the 4th in our series of the Neil Campbell reports, as you say, soon to be Emmy winning on some platform. Yeah, today is, we're talking about something that's in my wheelhouse. That's sort of what I call my sweet spot. It's that intersection between recovery and incarceration and criminal justice. And we know that they are very entwined in our culture, in our community, and we are trying to change that. But most of all, during this crisis, we have some ideas for helping people get by through this, and what we want to advocate to help people who are incarcerated be released if at all possible. Because as you know, this disease and this COVID-19 is highly infectious, and prisons and jails are just ripe for these diseases to spread, because you can't do the things that people on the outside can do, such as physical distancing or having access to the hand sanitizers and all the things that you need. So you don't have those type of methods and modes to deal with. And so we really think that this is serious. It's becoming serious, and it's not going to get any better anytime soon.
Well, and as people come on, I thanks to you allowed me to be a part of a graduation ceremony, which happened to be yesterday at the Campbell Correctional Institute, which is up in Blairsville. But the protocols there, it went from an in-person event for most attendees to a virtual event. Even the families of the graduates were not allowed to be there in person. It was pretty much only the staff that's there all the time and the graduates. And this program is truly unique in Georgia because they work with rescue dogs. But being a virtual connection with these men that were graduating and hearing they each gave remarks of what it was like for them to be in a facility during COVID was very moving and very powerful. Yeah. They dealt with real world issues of health and safety. So I know it's not theoretical, because I heard it yesterday firsthand, and I just appreciate the discussion we're going to have today about this. And so we do have some folks coming on now, and we do want to keep these within our reasonable time frame. So this is one of those issues that is critical, particularly during COVID-19. The Georgia Council on Substance Abuse, at your direction, issued a press release some weeks ago calling on the governor and the Department of Corrections and all the other appropriate agencies to take humane actions that protected the public safety of both those in the system, their families, and the community at large. And so again, you were leading on this issue weeks ago in this crisis, but we want to keep talking about it over and over. So I know there's some 5 or 6 things that you feel like we need to focus on. So I'd like you just to walk us through those points so that our state leaders who we know follow what we're doing hear from you directly on these.
Yeah, thanks, Jeff. And I also want to give a little bit of background or lay a little bit of groundwork about Georgia. So and I looked at the number of confirmed cases in Georgia right before I came on here. They update that every day at 6 o'clock, the Department of Corrections website. And as of yesterday at 6 o'clock, there were a total of 99 staff that were confirmed cases of COVID-19, and 238 inmates were confirmed cases. We've had 1 staff death and 8 inmate deaths. And when we think about, the population in Georgia, there's over 102,000 people who are they're Georgia residents that are currently incarcerated here, that are locked up. And there's over 400,000 people on probation and parole in the state. That's a lot of people. And so we have some recommendations for that. But I also want to talk about, Jeff, you and I talk about this just about every day, the racial disparities that exist. And if you think of Georgia, it's almost like an X. We have Black people make up 31% of our total population, yet it's 58% of all people who are incarcerated. White people are 56% of the total population, 33% of the incarcerated population. And the Hispanic population is 9% of the total, and they're 9% of incarcerated. But if you look at the Black and white racial disparity, it's like this. And that's not, so that has to be addressed. So you're right, we've been talking and thinking about some recommendations that we have for our state and for other advocates to hopefully get behind. And the first one is a no-brainer. Let's reduce the number of people in jails, in our county jails. That's something the sheriffs can do. You can vacate bench warrants. The court can help with that. You can release people on their own recognizance if they're likely to show up for court and they're not a danger to themselves or other people. And then of course, release nonviolent offenders. And hopefully if they're pre-trial, release them and just give them a date to come back. So that's number one, release people from jails. Number two, reduce the number of people in prisons, both state and federal. And we would like to see people who are near the end of their sentence get released. They're getting out anyway, bring them home with preparation. And people who are on work release, let's get them home. We're gonna need a workforce when this is all coming through, when the jobs start coming back. And also minor or nonviolent offenders, would like to see them released as well. The third one is, and Jeff, I know this is near and dear to your heart, is to eliminate unnecessary face-to-face contacts and all of the fears that come with that. So that would be, you can postpone court hearings, and I know a lot of courts are doing that anyway. You can reduce the electronic monitoring program if possible with someone who's not a threat or nonviolent, because that requires some face-to-face as well. And then make the expectations around probation supervision clearer. I think a lot of people, we heard from one of our coaches, recovery coaches, who's out in the community every day. We heard her yesterday say that people are just really scared they're going to be put back in jail if they don't do the right thing. There's not a lot of good communication going on, including someone I know is near to my heart, Jeff Breedlove. And I also think we need to think about correctional health care in general. I've worked in prisons, I've worked in jails. Some people say, well, they get free health care. It's not the best health care if it's there at all, especially in some of the private facilities. So we want to see health care improved. But the way that can affect COVID-19, if you think about it, and I looked this up because I was curious about it, that health conditions are worse for incarcerated populations, chronic health conditions, than for the general population. And those are things like asthma, HIV, hypertension, diabetes, and heart disease. So, and if you think about COVID-19, that is also a vulnerability to get that disease and have it kill you. So we got to make correctional health care better. And that's going to help staff too. I mean, in all of this, I'm talking about not just improving the conditions for inmates and incarcerated people, but also for staff. I've been a staff. 26 years of my life I spent in corrections, both adult and juvenile. And there's just some things that we can do. And the fifth, and I think one of the most important things that involves the recovery community, Jeff, is to let's help reduce the stresses on families. You can provide unlimited free access to phones. So these people who are getting out can make plans. They know where they're coming home to. They know the expectations. We also need to make access to phone calls free, because a lot of people, their relatives are sick. We know we've got health disparities in the number of I read the other day that 80% of the hospitalizations in Georgia were Black people. And we know they're overrepresented in jails too. You have to be able to contact your families and be in touch with your families. For these vacant waiting rooms, I think about the visitation rooms are empty. People can't visit their loved ones right now. So let's put some capability to do video conferencing in there so people can connect with their families. And then I think we should make access to warm lines and recovery community organizations free and confidential. So an inmate, whether in a county jail or a state prison, especially one who's coming home, can know that we're here for them. There's a recovery community organization, as you know, Coweta Force, face-to-face recovery, PLR, all these folks are working with incarcerated individuals who are coming home. So let's make those phone calls free and confidential. And if they want to call our peer support warm line to say, hey, we've got formerly incarcerated people answering phones all day long, 7 days a week. Let them connect with us and we can connect them to people in recovery. So when they do come out, that their likelihood of success goes up. So those are my top 5, Jeff.
Well, Neil, those are 5 important and practical and achievable points that can become solutions that can be executed today by the state and local governments across Georgia. And what I was thinking about as you were articulating, particularly that last point about families, is at your direction, we also do the RCO COVID-19 report, and we've done 4 of those now. And all 4 of our RCOs, from Albany to Noonan to Atlanta and Athens, spoke about point number 5.
Yep.
And so the good work being done by RCOs across the state is congruent with all of those points, but particularly point number 5, that RCOs provide an essential role during COVID-19, but they need more resources from the state, from the private sector. We need those phone companies and technology companies coming in and providing the resources. And we need the Department of Corrections to suspend current contracts with for-profit providers and take care of the people of Georgia and their families during this crisis. And that should be for everybody in Georgia, not the well-connected, but everybody.
Everybody, that's right. And people wanted, Jeff, when people who are released from incarceration, I don't know many people who get out and say, man, I'm going to go right back at it. What I want to do is get myself right back in prison or jail. They don't do that. People come out with the best of intentions, but sometimes the opportunities aren't there, or they don't know that there's a community there to welcome them, or they're lonely, or they're scared, or they feel that their options are limited. And those of us who have lived successfully in the community and recovery can be that beacon of hope, and also that person to walk alongside them as they make better choices.
And Neil, I know that at the root of a lot of this, from my point of view, from advocacy, is that word politics. And there's a lot of folks who don't want to be seen as being weak on crime or whatever. But I suggest that this is pro-family, that it's pro-life, that it's pro-faith, that there's a time and a place for everything. And during a pandemic like this, we need a bipartisan support, and that it doesn't show weakness, it shows strength. And that we need to make sure that our leaders in the Gold Dome, our county commissioners, and our mayors are all doing the best they can do to do as much as they can do for the least among us, the most vulnerable. And frankly, the recovery community is impacted disproportionately by this issue, and we need our leaders to take action.
Yeah, and we need to get empowered around it too, Jeff. That we're big about empowerment and speaking out, and I think we haven't done ourselves a very good service in the last 40 years by not being out loud about our recovery. So the more we talk out loud, politicians and public policymakers can look and see, hey, I know somebody in recovery. I know someone who used to be incarcerated, but they got a job and their family welcomed them back and things are better. It's like they have to know it's possible, because the messages they get are that, are all about fear, and you got to be afraid of those people. And this, we got to show them that that's not true, that we are those people and we got better.
Exactly.
And, yes, there are people who you don't want as neighbors. I've always said that, because they could be violent, but there's also people, everybody needs a second chance. Everybody needs a lift up. And, I think who better to be that hand that grabs back and helps pull up than someone in recovery.
Exactly. And we'll bring this to a close. And if I can, I also want to affirm one of the points you made. And it struck me on the town hall Wednesday when you were sharing about what other peers had shared with you. And I realized that's the fear that I've had. I mean, I am on probation, and I don't hide that fact. But one of the real world fears that I have, and I still have it, no matter how much they assure me verbally over the phone, is what if during COVID-19 some lines get crossed and I encounter a law enforcement official doing a great job serving the community the way they know how to, but the database says something, and it's not his fault or her fault if they do their job.
Yeah.
But I have that fear. And I know if I have that fear, I know others have that fear. And so I personally appeal to all our leaders to make certain not only that you're talking about policy up here, but you're making sure there's follow through at the staff level, practically speaking, because I've never met the CEO of DeKalb County or a county commissioner in the probation office. I've only met probation officers.
Yes.
Those officers, they're good people, they do a good job, but they need to understand from the leadership what the rules are, and what the new protocols are. And they need to make sure that people who are on probation trying to do the right thing aren't traumatized unnecessarily.
Yeah, and one more thing, Jeff, I'll just say that we've been thinking about this for a long time. This isn't anything new. And when I say we, I mean the recovery community. We had, in 2011, we had our first year of CARES, our Certified Addiction Recovery Empowerment Specialists, our peer training. And after that first year, we trained 55 people. And we had 55 people in recovery. And so we had what we call our CARES Connect. We had 55 people in the room. We invited it was the head of the Department of Corrections, I think it was at the time, came and talked to us. And he said, man, I've got 400 people a week being released from prison. And I don't know what I'm going to do. You know, it's more and more folks, and we release them, and they don't necessarily have any place to go or don't have jobs. And one of the peers stood up and said, sir, I'll take them. I'll help. And another peer stood up and said, sir, I'll help. I got you. We got this. Let us know how we can help. Pretty soon, all 55 of us were standing up, staring at him going, you got us. Use us. We are here, and we want to serve, and we want to help, because that was us. So I think that's, I'll just put a pin in this, that there is a huge connection between mental illness, addiction, criminal justice, and we need to do some reforms, and we're here to help. We're in recovery, and we're here to help.
That's awesome. This is an important topic. It's a serious topic, and Neil is a subject matter expert in this topic. And so I know that her leadership will continue, and the recovery community will follow. And we will keep pushing our leaders to show that appropriate level of humanity and compassion to all populations of Georgia, especially those in our criminal justice network right now. We need it. We need it today, not tomorrow. And Neil's voice will lead the way. And this is the Neil Campbell report. We'll bring it to a conclusion for today, but I do think we've been renewed for week 2. Because it's on her calendar. So we'll try to get at least one more week of these, and we'll see how they go. We'll bring you 4 new topics next week of relevance to the Georgia recovery community. And Neil, as always, we thank you for your time and your leadership.
Thanks, Jeff. And I got to stop accepting calendar invites from you.
We're just getting started.
Thanks, my friend.
We always say recovery is real. Thanks for watching the Neil Campbell Report.